everyone. Today we are going to introduce telehealth for you. And this is our agenda. So what is telehealth? According to WHO, telehealth involves the use of telecommunications and virtual technology to deliver healthcare outside of traditional healthcare facilities. And telehealth, which requires access only to telecommunications, is the most basic element of e-health, which uses a wider range of information and communications technologies. And can you think about the healthcare which can access everywhere? And when using the telehealth, the medical education scheme, homebound patient monitored, consultation from the doctors, and the clinical care, we can access them anytime and anywhere when using the mobile health. And in various types of telehealth, we will focus in mobile health in this presentation, which is compared of Hong Kong and China apps. So let's see the IPO model first. In the healthcare worker side, which is the input, and the doctors or other healthcare professional will use the camera to communicate with the patient and also the microphone to answer them for any questions. And the process is using the legwork, data compression, the encryption, and the decryption. And in the output, which is the patient side, the patient can use the phone monitor, the loudspeakers, and also the microphone to communicate with the doctor.
Now I'm going to talk about telehealth in Hong Kong. Doctor Apps is a mobile app which can be downloaded in the App Store through smartphone. It is funded with the support of the Hong Kong Charity Foundation. The major function is to provide professional medical advice through FaceTime, online medical appointments, provide knowledge related to common disease in Hong Kong, can search for doctor by district and specialty, and provide current A&E service waiting time of all Hong Kong public hospitals. From the latest data shown in the mobile app store, it's revealed that Doctor App received rating 3.8 over 5 based on only 33 reviews with both positive and negative reviews. Doctor Apps in Hong Kong. Doctor Apps provide online medical consultation. It is good that it provides online visual medical consultation, and the doctor who participate in the conference is a specialty. However, online consultation only held on specific time and dates and only focus on specific medical concern. Moreover, the availability is low as you can only make visual consultation when doctor is online. More, Doctor Apps also provide health information related to common disease in Hong Kong through articles and videos. The information is come from reliable source with lots of data support and mainly written by the professional. Also, it is presented in the form of videos which facilitate better understanding. Furthermore, the user can search the disease by their own symptom and make online reservation for some of the doctor through the apps. However, the information is just a reference which helps the user diagnose their disease in a more accurate form. Doctor Apps also provide A&E service waiting time of all Hong Kong public hospitals. Through the apps, users can instantly know the A&E estimated waiting time, which facilitate them to choose the hospital with shorter waiting time or visit general practitioner nearby. But it cannot provide immediate help for the patient by any instant online reservation.
The Doctor app provides current and in-service waiting time of all Hong Kong public hospitals. The strength of this function is can instantly know the A&E estimated waiting time, and patient can choose the hospital according to their needs. For example, for severe case, they can choose the hospital with the shorter waiting time, and for minor case, or they can just go to some general practitioner nearby their district. And on the Doctor app, they also provide the list of the general clinic too. They can just go to there to seek for help. And for the weakness of this function, this do not provide immediately help for the patient. For example, there are no instant online reservations. So, as mentioned, the Doctor app provides a search for doctor by district and specialty function. This can search for different kinds of medical professional, for example, the Chinese medicine practitioner and physiotherapist. And we can make online reservation through the app. And we can choose the doctor with the help of clients review as well as the location. And the doctor on the list is more reliable and ensure that they got a license of it. And for the weakness of this function, not all the doctors can make online reservation through the app, just some of them can provide this service. So let me conclude some strength of the Doctor app. It improves the accessibility of doctor consultation and health information in a safe, effective, and appropriate way. And regarding the geographical location of both the clients and the healthcare provider, for example, it can be more convenient for the people who is disabled. And besides, it improves the cost efficiency by providing online consultation of the medical concerns and waiting time of the A&E service in the public hospital. And it decreases the chances of delayed diagnosis of the patient. It also brings the patient who is disabled or not able to reach the clinic more convenient, as I mentioned, and it minimizes the stress or worry by providing medical advice immediately for the patients. And on the app, it provides different kind of resources. For example, the videos and the articles, which is about the medical knowledge, and it helps to promote the public service through the app. There are some weaknesses of the app. Its limited accessibility. Online consultation only held on specific time and data, and only visual consultation provided, which physical health assessment cannot be performed on the patient, for example, palpation and percussion, which led to diagnostic errors. And for the most important, only Chinese version is provided in the app, which restrict the user group. And so we have come up some recommendation for the Doctor app. They can try to employ some doctor or nurses for 24 hours online consultation and cooperate with more clinic and help the patient to make reservation through the app. And maybe home visit checkup for those elderly who live alone or disabled and provide medicine and referral for them. And they can try to promote the app inside and outside the hospital and the clinic and try to cooperate with the hospital authority and to let more people know about the app.
To China, I would like to introduce an app to you, Ping On Go Doctor. This is a revolution app because it including the sub-healthy, and the treatments, including the in-house medication team AI system through the internet, including the e-commerce, doctor, hospital, pharmacos, insurance, beauty care, fitness, etc. So, it's set up a one-stop healthcare platform that develops an integrated suite of services. They recognize the need of the user both when they are in need of medical care and when they want to stay healthy. It's focused on offering online family doctor service empowered by AI assistant and in-house medication team to users who are looking for convenience and cost-effective healthcare solutions. Also, it offers a variety of offline service via the internet of healthcare service provider. They also cooperate with insurance in providing value-added service to policyholders that enable to the synergetic integrations of insurance and healthcare.
And now let's see how the app is work. First of all, you have to describe the symptoms. For example, you may say you have fever. And then the app will have the smart routine to list out all the doctors which is related to the fever or other symptoms for you. In those of the doctors, you may have the consultation with them. And after the consultation, the doctors will give you some recommendation. He will suggest you to the case adjuster and referring you to the hospital and also other examination at the offline hospital. Let's see the latest statistic of Ping An Good Doctors. On the 23rd September 2019, there are 300 million of registered users, which means 1 in every 3 Chinese internet users is the user of the Ping An Good Doctor. And at the end of the June 2019, there are 62.7 million, with the average consultation hitting 650,000 for the first half of 2019 of the monthly active users, which means there are so many monthly active users and the registered users, and those of the users had weighted 4.3/5 in the iOS App Store for the Ping An Good Doctors.
To tell about the Ping An Good Doctor. Ping An Good Doctor impacts the face-to-face interaction with patient, healthcare professional, or both. As it improves access to healthcare, people live in rural or remote area. They just need to have a phone and download these apps. They can access care more rapidly. Medical consultation can be arranged easily than before. So, it costs a high efficiency to healthcare. The cost is inexpensive and the shorter time for healthcare, exclude the cost of transportation and time, and people just need to stay in a local hospital or clinic without consulting a new healthcare provider. So, but how? I will show you in the next PowerPoint. These have a centralized electronic health record. People remain in the same healthcare systems. It can improve the quality of electronic health record. It's referred to the monitoring and delivery of service in patient home, involving a link to a hospital or a center that collects patient data. Because these apps also, if you recognize this and log into the apps, they can have your personal general conditions, and they can share your data with the other hospital, and they can get your data easily and treat your problem as simple as 1, 2, 3. So people with chronic illness, particularly the elderly, telehealth can be a powerful self-management tool because this app also provides some healthcare tips daily, and people can feel free to review or consult the healthcare professional regarding the medications. If you have some confusion about the medications, then just you enter the name of the apps, and the healthcare professional of the MAC information will be delivered to you immediately.
And to simplify, the app or set a version which is specialized for the elderly. So the elderly can use the app in a simple way to consult the doctors. And for the wrong diagnosis, and the doctors can instruct the other healthcare professionals to ask the information in more details, and encourage the patient to have face-to-face video call with the doctors. So the doctors can see the patient's face expression, and the patients can point out which area is painful or show the doctors how their wound is. For the comparison, to compare the Ping An Good Doctors and Doctor app, we have some criteria. First of all, for the accessibility, both of the apps are easy to access with the smartphone. We can just download in the App Store and then to access the phone and consult the doctor. Secondly, for the affordability, both of the apps are free consultation. But for further consultation, Ping An Good Doctor is much cheaper than the Doctor app. Thirdly is the popularity. Ping An Good Doctor is much more popular than the Doctor app because there are 300 million users in using Ping An Good Doctors. For the Doctor app, there are much Hong Kongers know the app. And for the social acceptance, the Ping An Good Doctor, there are 62.7 million monthly active users in using the app. But however, the Doctor app, we cannot find how many users are using the app, but we can see that it is 3.5 out of 5 in rating the Doctor app in the iOS store, so that the people is much more accept in Ping on Good Doctor than Doctor app.
For the target user, the Ping on Good Doctor not only target on the Hong Kong area but also the whole part of China, while the Doctor app is only target on the Hong Kong user. And that will explain why the Ping on apps has reached 300 millions of users already, but the Doctor apps is only a few hundred of users nowadays. And for the availability, Ping on Good Doctors provide 24 hours consultations. They even open in the public holiday, and while the Doctor app is only specific time frame for consultations, for example 10:30 to 12 o'clock, and the time could be vary every day, and this will confuse the end consumer whether the service is available or not. For the service diversity, they are both provide different kind of specialty, so they are all the same. For the payment method, Ping on Good Doctors provide alternative way for payment. They also provide WeChat Pay and Alipay and health cards, while the Doctor apps is only available in health cards. And now we move to conclusion. Telehealth consultation is not popular in Hong Kong because Hong Kong people can access to the clinic and hospital so easily. They can even consult the doctor in their neighborhood or can get the over-counter drugs at the local drugstore so easily. These kind of factors will affect the usage of telehealth consultation in Hong Kong. While the China's condition is different, the local pharmacy may be not available in their sub-neighborhood, that making the China's telehealth consultation technology much more mature than in Hong Kong. However, since telehealth will become part of our life in the future, by looking at the successful development of the China's telehealth consultation, we cannot underestimate the development of it. And that's the end of our presentation. Thank you.